15 years ago, I think that was at our first symposium that we did. And it's the first time I stood up and talked about dystonia, but it was the first time everybody else in that room ever talked about it with each other, sometimes out loud, or met anybody else that had been going through what they went through. And it was such a healing experience.
One of the earlier children's symposiums that I had the privilege of being part of, we were talking as just young children were sitting around, maybe 5 to 10-year-olds, just chatting, what is it like to have dystonia? And we, in our adult world, we have words that we can use that describe the pain. A child doesn't necessarily have those words. One little girl, she was lying on the floor, and I said to her, haven't heard from you. What do you feel? She said, I just want to know, why do I have to have dystonia? And there was silence in the room, and I didn't know how to respond. But one of the older kids turned to her and said, you have it. Get used to it, but I can help you. I thought, how powerful is that? We talk about adult support. These are the children supporting each other. And that's the beauty of this particular weekend that's coming up. Families support each other.
For exactly 35 years, DMRF has been at the forefront of science.
As a patient, it's important to me. In my case, I don't know if I'm going to come out of remission tomorrow or if I'm going to never be out of remission. You know, so for me, the knowledge, again, back to this word of assurance, the assurance that the foundation is on this and that science is moving forward and that new therapies and possibly even cures are in the future. As a patient, it's a very high interest to me, and I feel like you know, I can have a role in maybe helping that happen for other patients and myself.
We try to do everything possible essentially every day to communicate with patients, to engage them. We have a unique and phenomenal patient base or DMRF membership. These people are members of our foundation, receive all possible information we constantly prepare and produce, informing them about recent events in science, recent achievements, results. We try to engage them as much as possible in the process of doing science.
We wouldn't know as much as we do without the DMRF. They're just a wealth of knowledge and information, and they're really nice people.
What I can say is that we continue to pursue the causes of dystonia, the genetics of dystonia, and the treatment of dystonia. So what I can say to them is, be brave, hang on, eventually it will come. You know, there is definitely hope. There's a lot of progress being made, and I think the rate of progress, like the rate of progress in a lot of different areas, is accelerating every year. I think you know, when I see, just month by month, I see new advances occurring in the medical field, and it's really advances related to all different types of dystonia. So I definitely have a lot of hope that something in the near future is going to be, you know, a major breakthrough.
There's a lot of hope. There's a lot of positive news, positive progress out there. So that would be my message.
I've definitely learned to appreciate some of the simpler things in life, things that, you know, we take for granted, like just being able to walk long distances or being without pain. And you know, whenever I get an ache or a pain, you know, it means, you know, very little to me now, because I know in my situation it's, you know, it's a temporary ache or a pain. And you know, right now, kids with or anybody with dystonia doesn't really have, as of yet, their aches and pains aren't necessarily temporary. You know, they will be one day when we find better treatments and a cure, but right now they're not necessarily temporary aches and pains, and that puts a lot of things into perspective for us.
Without your support, we can't do what we do, the foundation not be able to do what they do, and it's critically important at this point in time that we maintain that support for the DMRF.
Thank you.
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 Thank you for helping support the Dystonia Medical Research Foundation.